politics now. We are joined by Senator John Thune, Republican from South Dakota. Thank you, Senator, for joining us. A lot to go at here. Let's begin with health reform. Where are we on the Graham-Cassidy bill? We're close, I'm told that, but how close are we?
Well, it's razor close. We're within striking distance, but it always comes down in the Senate to that handful of votes at the end that you have to try and swing. And so there are lots of discussions and conversations are going on and exchanging of information and educating senators who are still undecided about how this bill is going to impact their states. And I'm hopeful in the end that we'll be able to get to that necessary threshold of 50 votes to enable us to pass health care reform. This is really important. It's a commitment that we made, and Obamacare, as we know, is failing. It's led to higher costs and higher taxes and fewer options for people in this country. So we have to come up with a new way. And what's been laid out, I think, is a plan that is consistent with our principles, and that's distributing decision-making and power and control and money out of Washington back to the states and back to patients.
I think you're preaching to the choir, who are our viewers, Senator. The question being is, what's it going to take for us to get there, for Congress to get there, more importantly?
I think it's going to take, Ashley, obviously, persuading a couple of our senators who are still on the fence on this, but in many respects, some of it has to do with getting individual states who are impacted by this in a positive way to convey that to their senators. And there's a lot of those conversations that are going on right now. But in the end, it really comes down to trying to persuade that those last couple of necessary votes to get to 50, that it's important for us to act on this for the American people, to fix a failing system, and to convince these members that their states are going to come out well under the new bill. So it's all, at this point, kind of one-on-one conversations and trying to provide the necessary information to educate members to the point that they feel comfortable being a yes vote.
And talking of which, I'm assuming you are a yes vote on this as it stands?
I am. I've looked at it. I've had many conversations with our state about it. We think it makes sense, and we believe it moves us in the right direction. And I think that I give great credit to Senators Cassidy and Graham and Heller and Johnson for coming up with a plan that really does accomplish what we think needs to be done in repealing and replacing Obamacare, doing it in a way that protects people with pre-existing conditions and obviously gets at the issue of moving power and control out of Washington, D.C. so individual states can design programs that work in their states. The one thing we know is that a one-size-fits-all solution out of Washington doesn't work. That's what we had with Obamacare, and we can see what the results are: skyrocketing premiums and fewer options.